We rescued Kane back in August 2022 because he was seen wandering around the streets, very, very thin, a collar that was digging into his neck, and a severely mangled front leg. Unfortunately, we couldn't save his front leg, so we had to amputate. But the amputation was really successful, and he regained full mobility in a couple of weeks and had absolutely no problem getting around and running around the fields. Now, he was never very sociable at the shelter. He had no friends. He didn't like other dogs coming near him, and he spent most of his time alone, just inside the front gate. Even when it was raining, he wouldn't move, and we had to pick him up and take him inside. But slowly over time, he became friendlier to staff, especially the ones who took him out for walks every day. And for the most part, for 3.5 years, he had a good quality of life. He was never really put on much weight. I mean, he filled out, but he never became fat like a lot of our dogs. But then in November 2025, he started stumbling, his front leg giving way. So we ran every test possible. All his blood tests came back normal. He had some osteoarthritis in his front shoulder, but not enough to cause a rapid decline that we saw in his front leg. And then we took him to the new shelter so that we could give him better care. He hated being in the clinic in the old shelter surrounded by other dogs. He loved it for the first couple of weeks. This is him at the new shelter. But by about early February, he'd completely lost the ability to walk. The progression went from the front leg, like a creeping paralysis, into his back legs. Again, we consulted numerous vets, we did x-rays, but without an MRI, it's very difficult to know exactly what's going on. He also started losing weight quite rapidly. We think this is a separate thing, maybe, and it's possibly something called exocrine pancreatic insufficiency, which means dogs can't absorb nutrients. We put him on the best medication for that, and he is slowly starting to put on weight again. He's put on about 1 kilo since we started him on that. Now, we do massage therapy, physical therapy, and laser therapy every day. One of his sponsors sent us a small mobile handheld laser device, which we use daily on him. His appetite is great. He eats 3 times a day. He would eat more if we gave it him. But we don't want to overload him. And he's still very responsive. He's in no pain at all. You can pick him up, move him around, doesn't wince or anything. So we think it's possibly something called degenerative myelopathy, which is a slow, progressive loss of use of his limbs due to problems with his spinal nerves. But we're not sure. Now, we have had dogs come into the shelter like Kane when we've rescued, only able to move their head. And over the course of a few months, they've slowly developed full mobility. So we're not giving up on Kane. We're still, as long as he's eating, he's responsive, we're going to fight alongside with him. And he is fighting. He is a fighter. So we'll update you on Kane in a later video.